Yes, what is a stem cell facelift? That's a great question too. Now, imagine facial aging has three hallmarks. Like we lose the bones first, and the skin muscle system sags because of the framework loss, second, and we lose the stem cell count in the skin, so the skin quality goes down. In an ideal world, I have to reverse all of them. So in a facelift, only facelift, I can reverse the sagging. I have to do something about the bone resorption. That can be done by fat transfer. I can take the fat and inject them on the bone. But what I can do about the skin regeneration, about the skin quality, because that skin is the really important part of how the patients look or how old they look, right? And that can be done by taking the patient's fat, separating the stem cells and inject them into the skin. So a stem cell facelift is actually a combination of everything what we have there. So we will do a deep plane face and neck lift. We will do a fat transfer on the bones, and we will do a stem cell isolation and stem cell injection into the whole skin, into the muscles, onto the bones, layer by layer, treating all these three hallmarks of aging, namely again, bone resorption, skin attenuation and muscle attenuation, and skin quality loss.